Hi, good afternoon, and welcome to you all. My name is Dr. Gauri Kulkarni, and I head the medical operations here at MediBuddy. Today, we are going to talk about a very interesting topic that is how our emotions affect our health. And of course, I would like that all of you bring in a lot of your questions and any specific doubts that you may have that need clarification. And I'll definitely try my best to answer them. So I hope that you're able to hear me and see me well. If yes, then I would quickly start off the session. So, we have been talking about this whole time of how the pandemic has come up and how we have been kind of trying to cope with how our physical health, mental health, emotional health have all been kind of affected, right? Things have not been the same, and the fact remains that things might not be ever the same again. We may have to change the way we are, and of course all of this has affected us at many different levels, and hence it's important that we take a step back and see how this might have affected us at many levels, right? Be it physically, be it mentally, emotionally, socially, and so on and so forth, right? So today we are going to talk about specifically about how our emotional health is and how it has been affected during these times, and in general how our emotions play a role in the way our health is, right? So to begin with, I'm sure everybody knows what is emotions, right? We use this word quite commonly. We say, oh, you're a very emotional person, right? But what is emotion, right? Emotion is basically, if I had to put it in a very simple word, it is basically a complex state of feelings, right? The feelings that you feel inside, and it's a result of, say, physical changes or psychological changes, and these emotions then do influence of the way we think, the way we behave, and the way we act on, right? So it's a complex situation of feelings that we see, and typically what happens, our emotions keep changing. Sometimes we will be feeling happy or sad or anxious, and these may happen in back to back, right? So emotions are very in the moment kind of a feeling, right? Versus, say, something like our moods, which are more pervasive, that on an I've been feeling more or less, say, happy through the day, or I've been feeling more or less, say, sad through the day. But emotions keep changing according to the circumstances around us. And they also have a biological origin, which is very much into how our hormones play in our body, or how our neurotransmitters get released in our brain, right? So it's a complex thing in that sense. But what we've seen is that the way we feel, or our emotions, they do affect our health in many different ways, right? And this has been come to light even more now, so that we are more aware about mental health wellness, and what we need to do to keep ourselves mentally healthy, right? So let's start with things that we know very often, right? That what can emotions do when it comes to our physical health, right? Quite commonly it does affect, right? When we are not feeling well, or we are emotionally not feeling well, it does affect our physical health, right? To go back to what, say, WHO talks about health, right? Health in its totality is the sum total of health, be it physical, mental, social, spiritual. So each of them affect each other at some point in time, right? If there is one problem, if we have a physical health problem, it will help affect our mental health. If we have a mental health problem, it does tend to affect our physical health, right? So they are all very much interlinked and interwoven in that sense. So a lot of times when we do have we are not in the as we call it, we are not in the best of our feeling states. We tend to show physical repercussions of it as well. So on a day-to-day basis, you might have seen that, the day you're feeling dull or you're feeling low, one tends to see that it affects the way we sleep, or it affects the way we have our food, or it affects our exercise patterns, or even our day-to-day routine, right? Or it may affect our productivity at work, or it may uh, make you feel procrastinating, or it may also make you feel like not going to work at all, right? It also affects maybe your relationships in the way that you may want to converse with people around you, right? So maybe you know, people tend to say pick up fights, or there might be arguments. So a lot of these things are seen when we are we are not in the best of our emotional states, and this effect is pervasive through our physical, mental, and social health as well, right? So we'll talk a little bit more about this as we go ahead. But let me, you know, kind of focus the fact that why are we talking about this today, right? This has been something which has been there all the while, but what has 2020 taught us is that with the COVID-19 pandemic coming in, we have understood that health needs to be prioritized, right? You cannot, you know, health has to be priority number one for all of us, no matter what, right? And there has to be an increased investment in our health, and especially also so much more in our mental health at that, you know, be it at an individual personal level, or at our family level, or even at our community, or at a larger, world level. But it is important that we invest, and when I say invest, it doesn't mean just in terms of money, but if we invest time, and invest our expertise, and invest a lot of us ourselves into helping each other to bring more mental health wellness for everyone around us, not only ourselves but everyone around us. So I think it's very, very important that we keep talking about this um, more often than not, right? So that we are tuned to this fact. What we have seen during the pandemic situation, we have seen a lot of emotional upheavals, or mental health issues that have been brought to light, like people who have been having a sense of anxiety, or people have undergone, low moods and depression, people who would have had felt boredom, loneliness, or many times a sense of maybe even a guilt, or possibility that they may not be able to take care of their families in many cases, right? Undue fear, undue fear, sometimes even anger because of helplessness, right? So these are a lot of these things have been seen. For example, a lot of people have also, there's a medical condition called as hypochondriasis, which means, feeling that I am having the illness is also increasing, right? And we have seen that this has increased more so in this pandemic time, and has come in the forefront, right? um, and these are the kind of mental health issues that, we have seen because of changes in the way we feel, or our emotions, that a lot of people are going through. From a physical health perspective also, there's a cusp between physical health and mental health as well, right? A lot of times, emotions can lead us to behaviors which may not be the best. For example, use of, say, alcohol, or say use of smoking. These tend to also increase and then affect our health, right? Both at a physical level as well as mental health level. There have been patients who have come in and talked about specific health issues, such as uh, uh, you know uh, not able to sleep well. Now, either it is poor sleep, which could be less amount of sleep, or it could be excessive sleeping, both, with a significant association with tiredness or low energies and just fatigue at that, right? So this has also been something that a lot of people have been showing, and this can be an effect of how we feel, leading to what can happen to our health, right? So it's important that when something like this is happening, that we be aware of what's going on with us, right? So the first step to any change comes with awareness, I believe, and I think that's extremely important, that um, we kind of take effort to ensure that uh, we are aware of what's happening with us at a feeling level, at a physical level, and take more charge of the situation, right? A lot of us tend to kind of push things under the carpet or not look at it, right? But I think that doesn't help for a lot of us. So it's important that we um, we take charge of it by being more aware about what's happening around us, right? So I think that is extremely important in terms of being aware, right? The other things I think are important in terms of coping strategies that I will definitely talk or going forward. But let us look at a few things that are affected because from a physical health perspective before we go into coping strategies. Now, emotions. Now, when we spoke of what is emotions, and we spoke about a lot of hormones which play a part, or neurotransmitters in the brain which play a part in this. It's important to know that there has been a clear cut association between chronic emotional upheaval or chronic mental health stresses, which can lead to chronic physical diseases, right? So a lot of us do know about long-term chronic non-communicable diseases. Say if you talk about high blood pressure or hypertension, or you talk about sugar problems or diabetes or heart diseases. There is an entity called as irritable bowel. A lot of these things, which are primarily physical health problems, right? So these are chronic diseases which we see. They have been associated with our emotional upheaval. So it's important that we understand that when we talk of emotions, it's not just about the mental health side, but a lot of it is has a very biological origin because of the changes in hormones and changes in the neurotransmitters and the way they express themselves, leading to physical health problems, right? So these are chronic stresses, emotional upheavals are known to be risk factors for a lot of chronic diseases. A lot of people who suffer from allergies or eczemas are known to will tell you that if they are emotionally not well, they tend to have an increase or exacerbation of their skin health problems, right? So I think it's important for us to um, take notice of the fact that how we feel can affect our physical health on a long term basis, right? And it is important that we take steps to ensure that this is contained to some extent, right? We take care of it and work towards it. Now, does that really mean that we should keep our emotions away? See, we are humans, and of course we will have and we will feel all kinds of emotions, but the important thing is to have an underlying faith, or maybe underlying concept of, say, what we call as an optimistic attitude or a positive thinking attitude, which will help us to kind of tide over any emotional upheaval that we are going through, and help us to reduce our risk that this may have on our physical health or on our mental health, right? So it's important that we understand that. Now, a lot of you might feel that, what is positive thinking, or what is the meaning of being optimistic? It's basically, it's a practice. It's something that we would have to inculcate in our day-to-day lives, in our behaviors, in our way of thinking. It's a practice to focus on the good in a situation, right? A lot of times, our emotions play a part when we try to look at the at what is not good, right? And typically we have that tendency of looking at things which are the worst, or we look at the worst possible outcomes. But if we kind of train ourselves or try to learn to focus on the good in a situation, it can definitely have a very high impact on our physical and mental health. I think it's very, very important that we learn to do this, right? Traditionally we are trying to look, we are kind of conditioned to look at things from a fear perspective, or we're conditioned to look at things wherein the worst possible outcome might come out, and then work backwards. But I think it's important that we try and change that and try to look at good in any situation, right? Because that will help us in overall to be much more calmer and much more at peace or content in any situation, and help us to be more focused, right? And more driven during that situation rather than panicking or rather than having negativity around in that situation, right? So it can have a big impact on our physical and mental health if we start kind of having what I call as an optimistic attitude, or having an approach to positive thinking. Now, does that mean that we should make light of any situation, or we should ignore reality? No, I don't mean that, right? It doesn't mean that, reality is in the face, and I think we should look at it. But I think the simple thing is to um, use positive thinking as a way of approach to the good and bad in life, right? So that, with the starting premise that hopefully things would get better rather than hopefully things would get bad, right? So that kind of expectation, if we start with, most probably we will also work towards it better rather than getting sucked into or pressured by that negativity around us. That's something that we can try and do and invest in, to ensure that our emotions do not affect our health at large, right? So we can try doing that. Okay. Now, some of the, definitely, I mean, it has been known, and I keep telling that to everyone, that there are a lot of benefits of, having this optimistic attitude. Like, if you would have seen that people live much longer when they are more optimistic and they are more, in general, content. You see that the lifespan is longer. There are lesser risks of chronic diseases, things like heart attacks or any kind of long-term ailments. People who have such kind of attitude also tend to have a better, they are better at coping with any stressors that come their way. They're more resilient. I think people who have this a positive attitude or optimistic attitude tend to have better immunity. They tend to be able to fight, and they're more resilient physically as well as mentally. Of course, they have better pain tolerance. They have much more lower blood pressure, so the risk for long-term ailments themselves are very less. So I think it really works from a physical health perspective. I think from a mental health perspective also, I think it does help, because it helps us to be more clear, more focused, helps us to be a lot of we tend to be more creative when we are clear and focused, right? So creativity increases, better problem solving can happen naturally when you're having all of these. The chance of having say a depressive mood, or say feeling anxious, is lesser, right? Naturally, because you are more focused and more clearer in the thoughts, right? So I think it's important that we kind of inculcate this um, as a way of life. Now, it's very easy for me to talk about it in a 1 hour discussion, but it is something that we need to make a way, make a practice day in and day out, and then make it a part of our DNA. If we can do that, you will see that your health overall is better, right? Be it physical, mental health, or so on and so forth. So I think it's important that you try to bring in an optimistic attitude or a positive thinking attitude to reduce the risk of what emotions can play on your health, right? Now, you know the reason also why I say this is because a lot of times the way we think um, always has what we call as a bad filter, right? We look at the bad in a situation instead of looking at the good in a situation. So it's important that we are aware that such a such a behavior is there, or such a thought process is there, and try to kind of change it by by practicing to see more positivity around us, right? Now, this could be in many ways that you can practice, like keeping a gratitude journal, or trying to looking or reframing the way life brings on challenges to you as looking as a opportunity for growth, right? So there will always be, life will throw challenges at us, but how do we look at it as a place of opportunity and try to grow from it, right? Instead of being pressed down under that challenge, right? So and I think that that helps, if we try to kind of remove that bad filter, as I say. I think that's a good thing that we can do over a period of time. Okay. I think it also is very helpful if we bring in certain techniques, right? if you see that there is an emotional upheaval happening, I think at a physical level we can do a lot of things to reduce that or reduce the effect of that on our health, right? So say for example, learning breathing techniques, being very cautious and mindful about our breathing, looking at the positive in that situation, right? Trying to relax at that point in time, doing a very mindful visualization, or what we call as the imagery technique, to look at something which will calm us down, right? In our mind, right? So that is something that we can do. I think also it's very important sometimes to just smile through the emotion as well, because sometimes when we push it into us that we would want to feel better, we actually start doing it at some point in time, right? So be it bringing that smile on your face or making someone else smile, right? I think that really brings in a lot of change when it comes to how we can deal with our own emotions, right? Now, as I was mentioning, right, that emotional health does affect our physical being. So it's important that we not neglect our physical health. Okay. So, yeah, a lot of times our lifestyle, be it our stressors or our sedentary lifestyle, has shown to have an effect on our chronic disease expression early on in our life, right? So and that has been the reason for that has been also the kind of emotions that we are showing these days, the amount of stressors that people are going through these days, and it has kind of made it even difficult for people and leading to many more people having physical health ailments, right? So though on one side it is about taking care of your emotions and taking, trying to have a positive attitude and thinking and working towards that, the other side is also that you be very mindful about your physical health in that sense, right? So this might affect or be a risk factor for your chronic diseases, but do not neglect it by not doing, say, by not attending to your own body, right? Which means that it's a good idea that you get your health checks done, meet a doctor regularly or speak to a doctor on phone regularly, so that you are sure that physically you're well, right? Now, comes, so that is one part of it, right? When it comes to how we can take care of how emotions cannot affect our health. But I think the other side is also very important, where we talk about say how you can cope with your with the issues of mental health that can come up because of the changes in the emotions that we are seeing. So as we were talking about, say, low moods, depression, anxiety. We have been speaking about things like guilt and helplessness and loneliness and boredom. Now, these things, if they do come in, I think it's important that we do kind of learn coping strategies. And along with coping strategies, I think it's also important that we seek help, right? Now, when I talk about, say, um, coping strategies as well, so I think it's important that we think of what we can do in a particular situation, right? So I think it's, when there is any kind of a situation which is emotionally triggering for many of us, I think it's important for us to first uh, attend to it and be aware about it, right? As opposed to trying to just keep it away. I think because it is not going to go away. If you're going to feel something, then it is very much inside you. So I think let it come to you, but look at it in a very scientific way, right? Be very objective about where it is coming from, right? So once you do that, it's important that then you try and figure out what you need to do about that particular emotion that is happening, right? So on one hand, let it come to you, you dissect it, but at the same time, don't make it as your own, right? Try to think of something which is calm and serene, or try to as I was talking about mental imagery of thinking of something that is really calming for you is a very good idea, right? It's also important that during this time you seek help if you're feeling so, right? Now, help can be in the form of your family, your friends, or people who who matter to you or to whom you can easily reach out to. Sometimes that's all that is required. If you have a listening ear, that usually takes care of most of the things that you are going through, right? So it helps to call up people you have not spoken to, or reach out to your parents or family or friends or spouse, so that keep the channel of communication open, so that you are able to address the emotional upheaval that's happening at that point in time, right? So reach out and seek help that way. If you're not having anybody that you think you can reach out to, or you say sometimes you want it to be so private for yourself, I think there is no harm in reaching out and asking for help from a professional. When I say professional, it means a mental health professional, like a counselor or a therapist with whom you can talk to, or connect with and understand, and they can help you to, one is to listen to you, reflect on what your thoughts are and what your feelings are, and then give you some kind of coping strategies that might be helpful to tide over that situation, right? Now, these are some of the things that you can do, right? But I think it's very, very important that we also understand what we should not do. A lot of times when we do have, uh, as I was mentioning before as well, a lot of times when we are in a emotionally upheaval state, right, a lot of us tend to go to things to seek solace, which may not be good for health, right? Which means a lot of people may tend to use tobacco, may tend to use alcohol, or any other recreational drugs, because it may seem that those will help them in um, calming them down or making them feel better. However, the fact remains that the use of alcohol or tobacco or any kind of recreational drugs do not do so. They do not, um, help in coping emotions, or any kind of symptoms that way. They only worsen your physical health. They worsen your mental health. They reduce your immunity. So it's important that you um, try and not use these techniques if you're feeling so, but rather keep away from them, and seek help from a mental health professional. Now, there might be times when when this is becoming to a place where it is like a mental health disorder, maybe where there is, say, diagnosed depression or an anxiety or any other kind of a problem, then I think it's important that we seek help from a doctor, right? So psychiatrists are usually, mental health professionals who understand the biological nature of a lot of mental health issues, and then they can prescribe, if required, the right kind of medications to help you to tide over the problem. Okay. Now, a lot of people feel that, oh, if I go to a psychiatrist, they're going to put me on certain medicines and then I will be labeled. And there's a lot of stigma around it. But let me tell you this, this is as normal as any other ailment, right? Our brain is a part of us. So just like you may have, say, a fever which needs treatment, or you may have, say, a fracture which needs to be fixed. If there are any mental health issues which are even coming out of because of emotional upheaval, it's important that you seek the help from the right person. And especially if there are medications required, then you should reach out to a psychiatrist who will help you in diagnosing correctly and then treating you correctly. So do not feel that going to a psychiatrist is going to get you labeled. It is not so. Please be open about this. If you have friends or family who are undergoing mental health issues, be open about discussing this, and seeking the right kind of help for them as well, because I think it's very, very important, right? Now, so recognize that, and seek the help from the right professional. Okay. Now, if you are somebody who is, sometimes what happens is, people may not tell that I'm feeling so and so, right? But we may observe changes in our near and dear ones or loved ones, right? This happens, that you may see that somebody is, say behavior has changed, or someone is eating patterns or food eating patterns have changed, or somebody's sleep patterns have changed, or there might be, say, a worsening of a health problem. For example, somebody is already suffering from say tummy issues, or somebody is suffering from, say, eczema, and there is worsening of skin problem, or somebody is already having, say, blood pressures, but they are now fluctuating, right? Any worsening of any health problem, or if you're seeing that there is a change in the pattern of behavior, right? Behavior could be in terms of how they interact with other people, or it could be things like, change in, say, increase in use of tobacco or alcohol or any other thing. I think it's important that you recognize this as a person who needs help. It is possible, and be very gentle when you are discussing this with your loved one, because it is not something that anybody wishes to talk about very openly, right? So I think it's important that we observe if there are any such changes happening, and then go back and help them to seek help, help them to seek the right kind of attention that they require, say maybe from a counselor or a psychotherapist who would help in interventions and talk therapy, or a psychiatrist who would be helping in writing the appropriate medication according to the diagnosis that has been made for the individual, right? So be the catalyst for your loved one if it is so required. Okay. Now, I'm just looking through, just a moment. I'm just kind of looking through. There's some question which has, come up, right? So medicines do not help unless you help yourself. Absolutely. When you know you're depressed, you can definitely try to come out of it. Could you please summarize? Okay. So absolutely. So I agree. Absolutely. The first step to any mental health problem is to be aware about it and be accepting of it, right? Now, it can happen, as I was explaining, it can happen to anyone, right? Like we get a fever, or like we get a tummy upset, or we get a broken bone. Mental health problems are something that are very common, and it can happen to everyone. And at any point in time, if you see through your life, you might have gone through, say, depressive symptoms or anxiety related symptoms. These are very common to happen. So first thing is first, that we let us accept that this can happen to all of us. It is not something which is very alien. It is something which can happen to everybody. Okay. Yes. Now, once it has been accepted, and then we feel that it is happening to us, I think seeking help definitely is important if you're not able to get through it. Now, a few of the coping strategies that, keeping yourself occupied, trying to get your mind involved in activities of pleasure, things which you like, maybe they are hobbies, or they are something, they are things which or being with people who you like to be with. These are a few of the things that a person can do to keep and try and fight from the feeling low. However, it is not something that it is brought upon, right? This is because this is it's a biopsychosocial disease, right? There is a biological element to it, right? For example, depression has been linked with changes in the neurotransmitter levels of serotonin and dopamine in your brain. Like, this happens. This is something which has been scientifically proven. So if now there are ways in which you can increase this, right? For example, like if you are doing an activity which you like, you are going for a run, you're doing, you're spending time with people you love, naturally the serotonin and dopamine levels increase in your body. It is something that happens, right? However, if that is not happening, or the level of depression is severe, there may be a need of moderate to severe, maybe a need for looking out for help. Now, help can be in two ways, as I was explaining, right? Talking to a counselor or going through therapeutic techniques with the psychotherapist will help in the long run to be able to cope with the situation that one is going through. Okay. Medications come into play when there is moderate to severe depression, where the person is not able to even get through the therapy session, right? And these medicines are basically helping to increase the those neurotransmitter levels in your brain, to help you to be able to even attend to a therapy session if that is so required, right? So yes, The first step is that we try to be aware that something like this is happening to us. We try and seek help if that is required. Try techniques on our own self, and then try seek out help in the form of, say, therapy or medications according to the diagnosis made or the severity of the illness that is there, right? So it's of course one needs to help themselves. I think it's absolutely important that we help ourselves, but sometimes it may not be easy. A lot of people do not find it easy to be in a situation where they can help themselves, and that's the reason why we talk about uh, the right thing is to seek help if that is required. All right. Somebody has a question that, can you please summarize? So, we have been talking about emotions and how they affect our health, right? And so to emotions are basically feelings that we go through. They keep changing, right? Like, one split second I might be feeling happy, and then I see a news, and which is very provoking. It might make me feel angry, or it might make me feel sad, or it might make me feel excited. We don't know. So there are these emotions keep changing according to the situations outside, and it also then reflects into our behavior, our thoughts, and our actions as well, right? Now, it is known that these emotions can affect our physical health. It is known that they can affect our mental health, right? And also, emotions kind of picture the way our thinking process is, right? Um, uh, if we are pervasively in a certain set of emotions, then it leads to a certain kind of mood that we are in. So, for example, we have been talking about depression. So if you've been pervasively in an emotional state of feeling low or helpless or guilt or any of these, then you tend to have a pervasive mood of being low or sad or depressed, as we say, right? And that can then affect your body. It can affect your mind, right? So people who are, say, people would show changes in their sleep patterns. People can show changes in their eating patterns. So, for example, some people sleep a lot, some people do not get sleep at all. Some people get into excessive eating, some people get into loss of appetite or not wanting to eat. A lot of people get into procrastination. From a work perspective, there might be absenteeism or lower productivity at work. So these are the few things that can happen. A lot of people might get into being argumentative, or not able to concentrate at work, or feel very distracted. These are the things that can happen. From a mental health perspective, of course, it can, there are a lot of these mental health issues that can come up, right, when we are talking about anxiety and depression and so on and so forth. Feeling lonely, bored, feeling guilty at times as well, or helpless. So these are the things that can also happen. It's important to know that chronic moods of a certain degree can also lead to affecting our body in terms of the chronic diseases that we can have. So, for example, heart disease, or say diabetes or high blood pressure. It can be there as well. People who have a lot of emotional up and downs tend to have something called as irritable bowel syndrome. A lot of this has been associated with eczema or skin allergy conditions as well. So a lot of there is a connection between how we feel to the way it expresses in our body, be it at a physical level or at a mental health level. So it's important that we are um, we understand this and then work around it, right? There was a question which says, does a behavior change happen post COVID? Feel like being alone, not interacting with people on phone. Um, I'm so sorry, and it's one thing I would want to say is congratulations, you've been able to fight through COVID, and you are a warrior. So I think you should say, pat your back, and tell yourself that you have done a great job, right? However, yes, a lot of people who it has been known that post COVID, a lot of people go through something called as chronic fatigue syndrome, or even a sense of, post recovery. What happens? A lot of people have been known to feel low, tired, and even a sense of guilt because they got this illness, and there's a high likelihood that they might be a reason for maybe the family to get anxious about it, or they might have affected the way the family or friends or near and dear ones or loved ones, they may have it gotten affected, or even just that they are mentally they were stressed because of this person getting COVID. So that all brings in a sense of um, guilt, and sometimes feeling helpless as well, and that can lead to low moods in a lot of people post COVID. I understand that you don't feel like interacting with people and you want to stay alone. But this is just a passing phase. I think it's important that you reach out and seek help. Talk to people who matter the most for you, your near and dear ones. Be with people around you, or, who matter the most. If you think that you would not want to talk to people, and sometimes that's a personal choice that we make, I think it's important that you talk to a counselor or a therapist who would be able to at least listen to you and try to bring in some coping strategies so that you are able to get out of this low feeling which has come, right? However, this won't last for long. It's important that you keep yourself engaged. It's important that you keep yourself occupied, be it if you are at work, or be it something which makes you feel happy, and keep yourself at it, and over a period of time you will be able to get out of this feeling that you have. But yes, seek help and reach out to your near and dear ones. I hope that you feel well very, very soon. All right. If you feel, you can always, many a times what we feel is that I do not want to reach out to somebody face to face. And if that is the case, then I think it's all right for you to reach out to someone over a phone call, or a video consult or something like that, so that you feel you are at ease when you're talking to someone, right? So it could be just a phone call, but I think you should seek help, because of the way you're feeling. But this will go away, right? Most people who have shown chronic fatigue syndrome tend to kind of get better over a period of time. All right. So hope that answers your question. Okay. So getting back to what we were talking about, right? So, I had in the beginning, I had spoken about positive thinking or an optimistic attitude that we may have. So, what can we do, right? I think it's important that it's a way of life, or it's a behavior change that we need to bring in. And it's not that you can do it today, like suddenly one fine day you start doing it. But I think it's important that um, uh, we start taking baby steps towards it, right? So I think the simplest thing that I can advise everybody is to just smile more, right? So, if sometimes it's okay, we talk about fake it till you make it, right? So smile more. Just the fact that you smile more is most probably going to make you feel more positive, right? So there have been studies which have been done, all right, and which does say that people who um, smile more, especially when they were feeling in a stressful situation. They were more positive afterward. They had a more positive outlook afterwards, and they tend to benefit from that. So if it's a, and especially if it's a genuine smile, I think it helps. It helps over a period of time for you to have a more positive approach to your life as well. So I think you should smile more, right? I think it's also important that we spoke about something called as the bad filter, right? We tend to look at the bad of the situation, right? So maybe trying to think of a situation and kind of reframing it, right? If we can reframe the situation, to see see the goodness in it. Like uh, just the other day, I was we were trying to see that we were in the traffic, right? And there was a lot of traffic, and say, oh, that's, we are getting late. But then I realized the good of the situation is I was able to spend some time with my little one in the car, right? So that the good of the situation was that I could at least have that time well spent. So I think it's important that we try to look the positives in anything that we do, right? And there will always be something good in anything that happens around us. Okay. And hence, once we start looking at the positives, it's also important that we understand and bring this into what we call as a, say, very cliche term, what we call as a gratitude journal, right? So maybe just writing, or a gratitude jar, right? Writing what is good that happened to you, right? And it may sound very cheesy, but over a period of time, you realize that there's so much of goodness around, and that we are just blessed to have that, right? And if we can, it helps to just put it down in words and have it more objectively available there for us to look at it at any point in time, right? It also helps to have more and maybe at the end of the day, if you can do it, most probably you'll get a better sleep, of thinking of the good things that happen through the day, right? So do that. I think it's also important about what I spoke about, imagery, right? So thinking about something which is calming, or something which you aspire to be at some time as well, or what's your best possible future image of yourself, or where you want to be. I think that also helps in many ways to kind of have that, practicing that positivity, or a positive thought, or an attitude around you. So that is something that you can try and pen down, maybe, right? I think the other thing is also, um, you know uh, savor those small moments. We tend to look at our world in a very, either it's home or work, or family, things like that, right? Or very few points, but we don't look at the smaller things that have happened around, which might have also given you a lot of positivity. So it's important that, be more observant of the smaller things that happen around you, and the smaller goods that happen around you, and journal it. Maybe that will help in understanding and becoming more better, or a better version of ourselves, right? Just going back to a couple of questions which have come, right? So somebody who said that they have, their father has undergone a treatment for diabetic foot and has lost about 50% of vision, or 70% of vision in the other eye, and feeling very sad. I'm so sorry. I think it's, no, none of us want to see our parents going through ill health. And you are very courageous that you have been able to, support your father in this, right? So the doctor has today said that they would have to most probably amputate or remove the toe so that the foot heals well. So a lot of times what happens in diabetes is basically that there is what we call as a gangrene because of poor blood supply and then infection. The area tends to kind of die, right? That particular area. And that's the reason why it might be required that that part is having to remove, right? So your question is, how can we help him to feel better? I think it is a traumatic situation, right? Nobody wants to take a decision or a call as to, oh, no, I want to remove a part of my body, right? Nobody wants that. But I think it's important for your father to understand that, and you also to understand that this is the step that is necessary for the future health of your father, yourself, and everybody around you, right? So this is a decision that has to be taken. If it is required and has been seen by a doctor who has advised it, then yes, the decision has to be taken. The good in the situation is that if this is done, progress of the disease will be arrested, it will be stopped, health will improve, and though there might be a little disability, it is not something which would be life threatening, right? So currently, the way we will have want to weigh our options is that, though going through the surgery would mean losing a toe, uh, it will heal better, and of course he will be much better, he will be back on his feet again. Currently maybe he's not also back on his feet, right? So that is something that we will have to help. And I think it's important that we try to give him all the aids from a medical health perspective or physical health perspective, uh, to make him as independent as possible, but that will happen only after the surgery, right? So my suggestion to you would be that go ahead with the surgery. If and during the surgery, if you feel like, I think it's important because you are also having to make that decision for your father, talk to a counselor on phone, and pour out your thoughts, because it's not easy to see a parent going through such difficult times. None of us would want that to none of us would want to see that. So talk to someone so that it helps you to ease your your feelings and your emotions. Okay. um, there's another question which has come up. It is difficult to make our colleagues in workplace realize this and understand that challenges of people facing mental issues, despite of such awakening. I think it's important. I think the more and more people talk about it, and I keep saying this, right, that we have to normalize it, right? It is like, it is not a stigmatized thing. Let me give you some statistics, okay? Um, Say 1 in 6 in India are known to suffer from diabetes. So India is known to be a diabetes capital, right? 1 in 5 are known to actually have some form of depressive illness at some point in time. Okay. All of us at some point in time have had low feelings or sad moods, which might have persisted for a few days to a week or so. So all of us have gone through this, okay, all of us. And I think it's important that we are very mindful of it and we accept the fact that mental health is important and we talk about it more and more in your workplace. You could have focus groups where people talk about it and discuss about it and be a support for other people around you, right? It's extremely important that we open up about this and talk about this, and be a shoulder for our colleagues or friends or loved ones, whoever they are, and going through this. So it's important that you talk about it. It is not something that we belittle, okay? Our brain is a part of our body, just like anything else. And yes, it can also suffer, right? And so, as much as you would be empathetic to a person who has a physical health problem, we need to show that empathy and that care to someone who has a mental health issue. I think it's extremely important. And it's good that you brought it up, and you should talk about it. You should talk about it. But at the same time, see, one is to talk about it, but also we need to understand that we need to take charge of it, right? So hence it's important that we understand mental health from a very therapeutic perspective, right? If there is a need to seek help, we should not sit on it. We should seek help. If it means reaching to a counselor, psychotherapist, so be it. If you need to reach out to a psychiatrist, there is a need for drugs, whatever is required to, medication, for whatever is required to get yourself better, then I think it's important that we do this. Again and again. I think there are no two ways about this, right? So please talk more about mental health in your workplace. Talk about with your loved ones, colleagues. If you see any change in pattern of behavior in within your circles, then raise that and be very be open and give a listening ear to somebody who wants to talk to you, and extend the right kind of support that is required, right? So, I mean, I want to just close this discussion by saying that our emotions do play a huge role in the way our health is, and it governs our health in many ways, be it at a physical level or at a mental health level. It is important that we get aware about this, we talk about this, and we extend the right kind of support that is required for people who suffer. All right. So, I think we're at the end of the discussion. So, do take care. Bring on your questions if there are anything more that we need to discuss. And I'll be more than happy to help you out at any point in time. So, do take care. Stay healthy, stay happy, stay safe. All the best. Bye bye.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.